Addressing a National and International Crisis, The Shortage of Caregivers by Gary Florin. Demographic background. After World War II, the U.S. experienced a dramatic increase in its birth rate from 1946 through 1964, with over 76 million baby boomers born. According to the U.S. Census Bureau, 70 million of these boomers are alive today. Their ages range from 59 to 77, with the largest 5-year segment born between 1954 and 1959. Those boomers are now 64 to 69 years old. Demographers describe pre-1946 babies as the silent generation. Negative stereotyping. Thus, the silent generation make up the largest segment of our most elderly population, age 78 and over, and are the cohort most in need of short and long-term caregivers. Caregivers assist those who need help with various activities of daily living, such as housekeeping, cooking, bathing, dressing, transportation, etc. They may be unpaid members of a person's family or support network, or paid professionals hired from private businesses. Unfortunately, caregiving is often viewed as low-status work, making it difficult to recruit and retain skilled professionals. Caregivers are overwhelmingly women, historically underpaid in many professions. Staffing shortages. According to the American Association of the Retired Persons, AARP, there is a continuing severe shortage of caregivers in every category, ranging from the need for minimal supervision and simple companionship all the way to 24-hour intensive care in nursing homes and hospice care. The U.S. Bureau of Labor Statistics reports the nursing home industry alone has shed 235,000 jobs since March of 2020, 15% of the previous workforce. This is on top of other significant staffing losses and/or retirements across related healthcare sectors. Incentives needed. Caregivers typically say their exits from the field are driven by poor pay and benefits, limited advancement opportunities, risky working conditions, workload burnout, and lack of respect for their profession. Some workers have shifted to other healthcare roles in hospitals or private homes. Many become travel nurses, working temporary assignments in short-staffed facilities for higher pay. Some have had to take on caregiving responsibilities in their own homes due to aging relatives or have opted for early retirement. Thousands of others simply quit from the all-inherent stress in caregiving, including physical, mental, and emotional exhaustion. Caregiving crisis. Considering the dramatic decrease in caregivers across the health industry, increasing life expectancy, both riding a tsunami of 70 million boomers, all of whom are under age 78, this combination points to a social train wreck on the horizon if society doesn't take immediate steps to address this crisis. Many people would say that crisis isn't a strong enough word to describe the staff shortages, says David Grabowski, a Harvard Medical School researcher who studies the economics of long-term care. With the pandemic, we had a crisis on top of a crisis. The current situation is a staffing apocalypse. Recommendations. The Global Coalition on Aging, www.globalcoalitiononaging.com, provides several recommendations for alleviating caregiver shortages. In June of 2023, GCOA released its report, Healthy Aging in Practice: How Age-Friendly Cities and Communities Can Contribute to an Age-Friendly World, following a roundtable conference held in New York City, along with the United Nations Department of Social and Economic Affairs, UNDESA. and the New York City Department for the Aging and other stakeholders. The GCOA identified catastrophic consequences if society fails to make significant changes, including declining healthcare options as the aging population rapidly increases in the immediate future, worsening health outcomes with reduced resources on cures, treatments for Alzheimer's disease, higher healthcare costs, partly due to increasing staffing shortages across all health sectors, and undesirable living conditions as caregiving becomes increasingly inaccessible and unavailable. The GCOA recommends 4 major actions the healthcare industry should take to avoid a caregiving catastrophe. Respect for caregivers. Improving attitudes toward caregivers and eliminating negative perceptions is the first step in attracting more talent. The field must be reimagined as a promising professional career rather than a low-skill, last-ditch job. In fact, caregiving is one of the 10 fastest-growing occupations in the U.S., with 1.2 million new jobs expected by 2028. Elevating society's perception of caregivers involves promoting the immeasurable value that this workforce provides to society. Doing so will involve a concerted effort and clear messaging from all stakeholders, including governments, nonprofit organizations, and healthcare systems. Number 2, standardized training and educational programs. Standardized training and educational programs would significantly increase skill development while also legitimizing the value of caregivers. One of the main reasons caregiving is perceived as low status work is due to the lack of uniform training and professional standards, which help ensure accountability and consistent quality. There are currently no federal training programs for caregivers, and only 5 states require more than 1 week of instruction before employment. Number 3, competitive wages and benefits. Healthcare systems and caregiving agencies must account for the financial compensation of caregivers if they want to attract young, purpose-driven talent. Employees should be rewarded based on the significant demands of the caregiving profession and the many benefits they bring to our society. This includes competitive compensation that recognizes the expertise and intangible qualities necessary to be a caregiver, comprehensive benefits that are staples of other professions and will help attract and retain long-term talent, career development opportunities that provide caregivers with a variety of options for career advancement and skill development. Number 4, elevation and inclusion of caregivers as critical members of the healthcare ecosystem. The healthcare industry has the primary responsibility for changing traditional attitudes towards caregiving and must be the catalyst for building positive reputations for caregivers across society. Despite being on the front lines of delivering high-quality care and providing crucial assistance to people in need, caregivers are often excluded from the larger health and social care ecosystem due to negative stereotyping. Conclusion: the GCOA believes these 4 recommendations are just the beginning of a long but necessary path toward raising awareness and respect for caregivers in society. The healthcare industry is already aware of the problems. Now it must aggressively lead the way by incentivizing workforces, generating innovative solutions, demanding quality care, measuring results, and taking corrective actions when and where needed. Gary Florin is a Medicare 101 professional with We Know Medicare. You can reach him at 360-633-7626 and at www.weknowmedicare.org/Gary hyphen Floring.